Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Authority as it drives Nigeria towards universal health coverage. A strong workforce is the backbone of every organization. With that in mind, the leadership of the NHIA is making sure that it revitalizes the scheme towards fulfilling its mandates to Nigerians. Capacity building for staff and management is targeted at helping them drive the authority forward. These trainings are all geared towards repositioning the NHIA towards the attainment of universal health coverage and creating a better health insurance ecosystem. In the last couple of months, therefore, the NHIA has trained management, staff, CEOs of health insurance agencies, specialized units on various operational issues, a summary of which we shall be bringing to you in this episode of our program. I am your regular anchor, Aisha Muhammad Ahmed, urging you to please stay tuned for the full program starting after this timeout.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, Professor Sambo appears before House Committee to present the 2022 budget performance. Stay tuned for details alongside other news reports.
Appropriation that we receive.
The Director General, National Health Insurance Authority, NHIA, Professor Nasir Sambo, has explained that 641 million naira was appropriated to the NHIA in 2022 for various activities, out of which it has received only 160 million so far. The DG gave the explanation while appearing before the House Committee on Health Services to present the 2022 budget performance of the authority. The DG explained further.
What was appropriated to us in 2022 capital is 641 million for the various activities, maternal and child health and other activities, out of which we have received 161 million naira so far. We are still expecting, and as we receive, we disburse them to where they are appropriate. Then if you come to page 1, these are monies that is collected as premium. It comes to the National Health Insurance, where from it we pay the healthcare facilities, we pay admin charge to the health maintenance organization, and NHIA take admin charges from that amount as prescribed in any social health insurance globally. It is that percentage that we take that we will pay salary, that we will maintain offices, that we will maintain ICT infrastructure, and we do any other things that will help us in managing the organization.
After the presentation, Tanko Sununu, Chairman Committee on Health, enjoined the authority to make available more documents that will make the NHI budget more explanatory.
If you consider everybody to be a financial guru and make a presentation that cannot be self-explanatory, all this will arise. So please, next time, see how you can break them into an easily accommodated and ease perception and understanding of everything.
The Gombe State Contributory Health Management Agency, Go Health, has announced that it will introduce new health programs in the state to facilitate fair financing of healthcare services and provide access to quality healthcare and financial risk protection for the people. Dr. Abubakar Musa, Executive Secretary, Go Health, made this known to journalists during a quarterly media engagement in Gombe State. Musa further said the agency was about to introduce the Tertiary Institution Students' Health Insurance Scheme for students in higher institutions.
We've engaged with the management of Ministry of Higher Education with a view to enrolling all our students of tertiary institutions into the program. And we also reported that the management of Gombe State University, which is the largest institution, state-owned institution in the state, has already keyed into the program and has committed to ensuring that from the next academic session, all their students will actually be enrolled under the T-ship program.
Dr. Musa also added that Go Health is in the process of signing a memorandum of understanding with the Gombe State Transport Company, Gombe Line, to provide health insurance coverage for travelers using the transport service to take care of accidents and emergencies.
Welcome back. Like I mentioned at the beginning, capacity building is a major focus of the current management of the National Health Insurance Authority, headed by Professor Nasir Sambo. And to that effect, trainings and workshops focusing on various issues like leadership development, procurement matters, budget and planning issues for staff, management and key stakeholders are a major part of the current reforms sweeping the authority. In our next segment, issues around the NHIA, we shall review some of the recent trainings and workshops organized by the NHIA towards capacity building. Please stay tuned.
One thing that is important for any organization to thrive and grow is training, retraining, and capacity building. And this is exactly the path that the leadership of NHIA is treading. These trainings or workshops will put the authority on a trajectory of achieving its mandate and serves as a medium for capacity building, not only for the NHIA staff, but for stakeholders within the health insurance space. One of such workshops is the NHIA Leadership Development Program, organized for top management of the authority. Professor Sambo speaks more on its essence.
One of the things that we have identified, even at the inception of our administration here in NHIS, was the fact that some of the triggers of the crisis are as a result of poor management and leadership skill among the general managers. So that's why we are looking at this leadership training as the entry point of aggressive capacity building for attainment of universal health coverage in Nigeria.
The workshop also cascaded to CEOs of states' social health insurance agencies from across the country.
A lot of us seated here have gone for so many leadership trainings around the world, not even the country. But this might be like a refresher course for us. And just like Dr. Hope said, let's open up our minds. The whole idea of this is to foster better leadership, even in our organizations, not only to talk about the country. So a lot of things are going to be taken away in these 3 days. We all know that you are busy executives, and the 3 days is like taking away a whole world from you. But please, we want to employ that you just pardon us. It's going to be an eventful 3 days, and I'm sure that in the course of that 3 days, you will pick up some things to refresh your mind also about what we are trying to achieve by this training.
To further institutionalize training, the NHIA signed a Memorandum of Understanding with Resolve for Development on its Leadership Development Program, both for staff and stakeholders across the ecosystem.
The reason for this MOU is to be able to provide technical assistance to the National Health Insurance Authority in order to assist them in training and capacity building for the middle and senior level staff of the authority, as a way of helping the authority to work towards attaining universal health coverage in the country.
The NHIA also organized a 2-day internal capacity training for expanded top management staff of the authority. in order to keep staff abreast of checks and balances and fundamental principles as enshrined in public service role. The DG explained more on that.
I realized over time that the level of knowledge or procedure of discipline in the organization is lacking, and more so at the level of states. Staff are doing whatever they like without bringing them to order. The crux of the matter is some even state coordinators are not conversant on the procedure of ensuring discipline in an organization. So I wouldn't want to take things by chance. So I decided to bring all the top management, as well as zonal coordinators, and brought 2 resource persons, one from the office of the head of service, one from the human resource from the Ministry of Health. During our last meeting, they demonstrated to have a very good knowledge on the issue of disciplinary cases. So the event of today is to try to bring the staff up to the responsibility of this disciplinary cases.
Another recent training is a 3-day procurement workshop held for departments, statutory units, zonal offices, as well as procurement staff in the state offices. Speaking at the event, the DG, Professor Nasir Mohammed Sambo, who was represented, said the essence of the workshop was to help staff discharge their duties in line with public service rule.
If we are procurement officers and we are chief executives of our state offices, it is imperative that you acquaint yourselves with the nitty-gritties of the procurement laws.
Still, related to procurement and financial matters, the NHIA organized a 3-day training across the 6 geopolitical zones for budget and planning officers of the Basic Healthcare Provision Fund to help in the implementation of the program.
The rationale for this workshop is because we want to get it right. More so, we want all the agencies, including our NHIA state office, to continue to work in synergy so that we can get it right.
The objective of all of these workshops and training exercises is to equip the drivers of the scheme with knowledge and expertise to help the authority in fulfilling its mandate of making healthcare accessible to all Nigerians. They also bring all key actors together under one roof to move Nigeria towards universal health coverage. For participants, these trainings are timely, apt, and very necessary.
The workshop is very timely because the Basic Healthcare Provision Fund, this project is actually a novel project in Nigeria, and it's important that we start it off on a very good note, because if you don't understand how the entire program is supposed to be, then there is going to be room for errors.
The way this training is going, there is a lot of knowledge that was impacted on me seriously by execution of my BSCPF budget and also the work plan.
I'm glad having been part of this seminar or workshop rather, because this is more like the first of its kind. Since I was employed since 2014, I think this is the first time that Savicon has actually done this kind of training for us.
Thanks for staying tuned to the program Easy Access to Healthcare for All. In our stakeholders segment today, let's bring you an interview with Abubakar Hassan, the Director General, Kaduna State Contributory Health Management Authority, popularly known as KACHMA in Kaduna State. He gives us a brief history on the establishment of the agency.
The scheme in Kaduna State commenced operation in June 2020. And between 2020 and today, we are still rolling and we are still hopeful, we are still positive that the scheme will go beyond where it is. Today in Kaduna State, it started as a mandatory scheme for the formal sector. What do I mean by the formal sector? The formal sector meaning all government employees. Is it at the state level or at the local government level? So it means all of us are mandatorily expected to go into the scheme.
Abubakar Hassan enlightens us on persons covered under the Kaduna State Contributory Health Management Authority.
You refer to formal sector, you refer to what informal sector. These are the two broad categories. For the formal sector, we're referring to what government paid employees, which include what public servants as well as civil servants. But when you come to the informal sector, every person who is outside of it becomes what? An informal sector. But within the informal sector, that's where you have the categorizations. You have what? The organized private sector, for example. Businesses, small-scale businesses, artisans, small-scale businesses, even big-time industries that have what employees can all fall under the organized private sector. But banks, insurance companies, hotels, and stuff like that. Schools, for example, management and their staff. But these are quite different from what me as an individual who thinks I do my normal business, I just want to enroll my family into the scheme. That's informal sector. But also within that segment, we have the tertiary institutions, okay, where we have students called the T-ship program, okay. But again, in Kaduna State, we have children in secondary schools.
Bearing in mind that the health insurance under one roof brings in everyone under the ecosystem together, Abubakar Hassan shares his thoughts on the new NHIA Act.
Talking more in terms of an act, I think comes with a bit of more regulation. It comes with a bit of more emphasis in terms of the journey towards the attainment of our universal health coverage. I think the concept is now being more definitive, more emphatic, and that's why significantly you will see that in the current act, the action in terms of mandatory now comes to be, in this scheme. And other major critical aspect of it is the fact that there is that commitment to now emphasize on the most vulnerable groups within the country, that the scheme is willing to go towards identifying these different vulnerable groups so that all are inclusive into the whole agenda of the attainment of a universal. So it becomes now a more inclusive act towards addressing the different entities that will actually come together to help us to realize the attainment of this particular goal.
With the target to achieve universal health insurance in the year 2030, Abubakar says the effort of both the NHIA and state health insurance agencies make the goal possible.
From the new act, you all heard what the president said, okay, that the federal government is now willing to address 82 million vulnerable Nigerians. If you take out 82 million vulnerable Nigerians and you are addressing their health needs, 82 million is what percentage of Nigeria? That is more than 50%, if I'm not mistaken, or a little below 50%. So if 45%, for example, is already been addressed in a particular year, for me, the attainment of universal health coverage will be something that will only be talking in history, because we would have achieved our target before even at that particular time, because now the government is taking care of the vulnerables. The government is also making now health insurance mandatory across board. And don't also forget as part of the new scheme, there is also the counter part from the states. Specifically talking about Kaduna State, I will tell you, Kaduna State is already giving out 1% of its consolidated revenue towards the vulnerables in Kaduna State, in addition to what the federal government is also doing. So if all the states are also taking this step towards addressing the vulnerables within those states, within all of the states, up to the federal government, we're talking about more than 70 to 80% of coverage.
Finally, Abubakar Hassan speaks on efforts put in place to make healthcare accessible for the people of Kaduna State.
One major aspect that I think we're still working to get people to know for Kaduna State right now is the fact that initially when the scheme started 2 years ago, 2.5 years now, an individual is expected to make a down payment of 10,650 naira. Today, that is already that is no longer the case 100%, meaning that it is a choice. You want to pay 10,650 naira, you have the opportunity to do so. But you want to spread it, it is important that people should know that you can now take between 1 to 3 months to be able to pay up your premium.
You have heard from Abubakar Hassan, DG, Kaduna State Contributory Health Management Authority, speaking on issues around CACHMA, health insurance, universal health coverage, and the NHIA. We will now take your questions in the last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: does NHIA cover delivery commodities?
NHS, when we talk about delivery, what NHS does is that there's a difference, a little difference, or when you say the word commodities of a wider range. So what NHS does is that it covers all the drugs and also the consumables. The word consumables are the ones that are more of medically related. Things like syringe and needles, things like gauze that they use during the delivery, things like cotton wool, and things like sutures that they use for suturing during the process. But other commodities like soap, like sanitary pad, like the diaper pack that they use to clean the baby, such type of commodities are not covered under the scheme. So I think the enrollees or our mothers that are going, that is to the maternity area, should get this thing clear, that it is only the consumables that are being covered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
And so, we draw the curtains on this week's episode of the program. NHIA is leaving no stone unturned to see that it fulfills its mandate to Nigerians. Join us every week as we continue to bring you updates on more of its activities and strategies as it marches Nigeria towards universal health coverage. See you next week.